Obsessive compulsive disorder, or OCD, is classified in the DSM-5 as obsessive compulsive and compulsive related disorders.
People think of OCD, they think just about counting numbers and just about checking locks and safety, and probably because media only shows that part of OCD.
OCD can be recognized in a variety of ways, primarily with the presence of compulsions or obsessions. Compulsions are attempts to reduce the distress caused by obsessions. These behaviors are either clearly excessive and not usually connected in a logical way, or the individual can be aware that their obsessions and compulsions are not logical, but stopping these behaviors is far more difficult as they are uncontrollable.
It's kind of like a controller of your life, you know? It's kind of like, I don't know, a lot of the things that you do in your life are based around, you know, certain habits that you feel you have to do, or rituals you have to complete, or like thoughts that, you know, are invasive. And I don't know, it's a big deal.
OCD is something that controls every aspect of my life. Sometimes I feel like I have two different brains, and one of them is rational and one's irrational. And the rational brain knows that these intrusive thoughts aren't true, but the irrational brain is still there, kind of telling it what to do. OCD patients experience obsessions and compulsions that are time-consuming and disruptive to normal functioning. Symptoms are not typically correlational with psychological effects, and it is common for patients to have an inflated sense of responsibility and to overestimate threats with perfectionism or other obsessions with symmetry. Obsessions are not wanted, and they are intrusive and involuntary, and they typically cause anxiety.
Some of the OCD symptoms that Fiona exemplifies include blowing out of proportion seemingly normal events. For example, she will feel that a grade or that she perceives to be bad on a test in one class will prevent her from getting into college. Things like that. Also, obsession with symmetry. She will want to, or when she locks her car, when she pushes the lock button on the remote control for the car, she has to push it the same number of times every time. I think she turns light switches on and off a couple times before they're in the position that she wants. And when she's doing things like decorating a cake or cookies, the frosting or the decorations have to be very precise, or it's frustrating for her.
Criminal, like at night she like goes off and turns all the lights off and like locks the door like 3 times.
Yeah.
And then like, which it's like it's like good that someone's doing it, because sometimes you just leave the lights on and keep the doors unlocked, but it's it can like it gets really loud, especially if it's at like, sometimes it'll be like 1 in the morning, because that's when she like goes to bed sometimes if she's studying, and she like can like will study for a long time, and it's like the last thing she does
has to do. Yeah.
The 5 primary subtypes that categorize OCD include contamination obsessions and cleaning compulsions, hoarding, obsessions without visible compulsions, symmetry obsessions with ordering compulsions, and harm obsessions with checking compulsions.
Hoarding apparently is especially a side effect of OCD, yeah. And I didn't think I really had it, but you know, after going to therapy, I realized that it's not like bad, you know, like I hoard a lot of, I'm not like one of those people you see on a reality TV show or hoarder show or whatever, but it's like when I was little, I used to collect like boxes, and I was like, I'm gonna use them for my Valentine's Day box. I'm gonna make this really elaborate Valentine's Day box. In like 5th grade, and anytime somebody would touch my boxes in my room, I would like freak out. And I think that, you know, like you were saying, there is that element of control. Like you need, you know, I need to have control over my stuff. Or sometimes my mom will go into my room and like take some of my old clothes and take them to Goodwill, and I will go ballistic. Like I need to have that control over my stuff, you know. And I didn't realize that hoarding was kind of an aspect of OCD, but it's like, it's kind of intrusive thoughts as well. You know, it's like if I get rid of this, then I'm never going to remember it. And it's been such an important part of my life, even though it's really not. Like the goldfish box from my parents' Costco trip is not important.
One of the big subtypes that I experience is obsession with symmetry. And so that creeps up in a variety of ways in my life. But the most prevalent one that bothers me the most is that when I am aware or when I'm having a really bad, stressful day, and I'm hyper aware of all the sensations that my body is receiving, if somebody bumps one shoulder, I have to repeat that motion onto the other shoulder, which is really frustrating because then if I don't repeat the motion exactly correct, I need to continue doing this like weird dance until I feel balanced. I also have this where whenever I'm in a room, I am trying to draw the longest uninterrupted line down a wall possible to see how symmetrical I can get it. It's just my brain is constantly looking for patterns to make things complete and whole and even to essentially mitigate this anxiety. It is important to recognize the difference between patients with good insight who can recognize the irrationality of their OCD and those with poor or no insight who believe their irrational thoughts. Cases where the individual has no insight are uncommon, with only making up 4% of OCD patients.
Yeah. Yeah, I think that just in terms of approach, when somebody is unaware, the important piece is to bring awareness, noticing what the mind is doing, what is happening in the environment, what feelings are coming up, and then how one is responding. And so maybe what that compulsion is, what that behavior is, or the thought that continues to come to mind. And then somebody who is aware of it is, I think, just having patience and grace and helping to find supportive ways that are helping to fulfill whatever that need is. Yeah. Because behaviors and obsessions have a need.
OCD frequently is coupled with other disorders, the most common ones being a tic disorder, skin picking disorder, generalized anxiety disorder, depression, insomnia, and control-based eating disorders.
She picks her scalp a lot,
Yeah.
which doesn't necessarily affect me in a way, but my mom, it's something I notice, yeah. And my mom will always like call her out on it, and then sometimes it'll get into this argument like, yeah. Don't do, and then that then affects me because I'm like having to listen to this, and I like try and like keep it out.
Coupled with my OCD are a couple of the common disorders. I have terrible insomnia. I'm a very anxious person. I've been diagnosed with generalized anxiety disorder. I have a tic. You've probably seen me doing it. It's rolling my neck like that, constantly doing it. So yeah, there are definitely quite a few different coupled disorders. Skin picking. My nails they're alright right now, but they're usually pretty short and torn up. But yeah.
Also a lot of like skin, picking, and yeah, I like hyper focus on my skin, whether that be like my face and trying to like, I don't know, make sure I have like clean face with no oil in it, or my scalp or my fingernails. Yeah, a lot of it has to do with anxiety though too, If I get nervous, a lot of it is driven by anxiety. But OCD is also a branch of anxiety, so.
OCD affects a wide variety of individuals, and it is typically diagnosed early on in life. Females are affected more in adulthood and males more in childhood. It is diagnosed following a 12-month prevalence of symptoms, with 1% 8.2% of the US population having OCD, whereas internationally the prevalence varies from 1 to 1.8% of the population. The development of OCD follows a pattern of familial transmission and is chronic, with a gradual onset. The mean age for symptoms to occur is 19.5, with 25% of cases starting before the age of 14. OCD treatment varies per person, but a combination of cognitive behavioral therapy and antidepressants has shown the most successful results. Cognitive behavioral therapy is effective particularly in exposure and response prevention, where the patient is gradually exposed to their fears and obsessions. However, this therapy does depend on the transparency of the patient.
Understanding OCD as over control. And so, for example, a treatment like dialectical behavioral therapy is typically meant to treat impulse behavior and creating space and pause moments to be able to effectively move through the world. And somebody with OCD has more over control tendencies, and so they don't need more control. So something like DBT, there might be some moments in there that would be effective. And so a treatment that does show some effectiveness is radically open DBT, which is a variation of it. So doing just the opposite. So not treating this under control impulsivity, but the over control, and how to create more flexibility in things that are really rigid. And then also looking at a combination of changing the thought patterns, but also giving replacement behaviors that are fulfilling that need. So if there's a treatment that's just doing one, say, we sort of talked about this, but say that you're working on exposure to a certain stimuli that feels really, really distressful for somebody. Someone with OCD might not know what to do instead, or how to self-regulate without a behavior that is fulfilling that function.
Psychoanalytic and psychodynamic therapies are ineffective most of the time with OCD patients. This is because while they can be used to find the root source of an obsession or a compulsion within the patient, identifying the cause doesn't typically help with the treatment of any of the experienced symptoms. However, it does help when diagnosing a patient. Humanistic therapies also don't typically mitigate symptoms. However, the humanistic approach for OCD therapy can be beneficial when working towards acceptance and individual growth with the patient by allowing for them to focus on being kinder to themselves. One of the most effective OCD treatments is radically open DBT therapy. It is a cognitive behavioral therapy that links emotional communication to the creation of social bonds, and these bonds typically target neurophysiological arousal and skills that target social signaling.
You know, the stereotypical like organizational thing, you know? It's like, oh, I need to have my pencils.
Yeah, that pisses me off.
Yeah, and it's like, okay, so you want to have your desk organized, like, can you not fall asleep until all of your papers are symmetrically lined up before you go to bed, you know? It's like there's such a scale to which, you know, it has effects, and I feel like there's people who, you know, say they have OCD but they don't actually like have the struggles that go along with it, you know? You know, they just have to, they want things organized, you know, and that's a common thing, you know, like having organizational skills is like a common trait to want to have. Yeah, I don't know, but a lot of times also OCD can make you disorganized, and people don't know that.
I used to think that OCD was just like that sort of thing where it's what they show on TV is like, oh, this and this, like this, like the quote unquote like smart person has to have like, again, all their pencils right and their,
Or like their hands clean.
Yeah. And it's like, well, I used to think that, but then when I realized that Cameron, that's what Cameron had, and it's like, oh, this, I didn't know that, and I feel like it kind of need to kind of brainwash me into thinking that.
Yeah.
People with OCD are often portrayed to be sort of stuck or captive to their obsessions and compulsions, and stuck in this rigid life where they have to do the same thing every day and not have new experiences. Living with Fiona has helped me see a new perspective, or change my perspective on OCD, to see that that's not the case. People who suffer from OCD are able to try new things, have new experiences. It may be harder for them because of this resistance than these symptoms they feel, but it's not something they can't do. An example of this is Fiona tried a new sport this year at the age of 17, and a junior in high school, something she'd never ever done before. But she was able to fight against the obsessions and compulsive behaviors and be able to learn the rules and just learn the basics of how to do the sport. So, and she was successful at it.
Current research is being conducted using MRI scans to develop treatment for the neurological differences people with OCD have. Michigan University of Medicine recently conducted a study showing that OCD patients' brains differ from neurotypical people in the areas of the brain responsible for responding to errors. This research showed that OCD patients have a very high amount of brain activity in the areas of the brain that are able to detect error, while they have lower activity in those regions that allow for them to respond to the errors.
I think just knowing that experience is real for that individual, and yeah, we can think and talk rationally, that person can see that, and also understanding and recognizing that is how their brain is working in that moment, and that sometimes no amount of rational thinking or talking through it is going to fix.
And I think it really, having it makes me more, I have more urge to educate people on it, just because there are so many people that suffer with it, and if we live in a society where people are oblivious to different mental illnesses, then there's less understanding, and there's less communication, and there's less, honestly, kindness. So I think that has become a tool, like being able to teach my friends, like, this is what is happening if I'm doing this, or I don't actually mean this if I say that. And I don't know, I feel like it's kind of enlightening to educate people and to teach people about, the different ways in which people think and behave.
I want people to know that OCD is uncontrollable. These irrational thoughts aren't really who we are as people. They're a part of our brain that we can't control. It's a mental illness, and that it's comparable, at least in the way that it's inherited, to a variety of other, like, physical diseases, like diabetes. OCD is something that is uncontrollable, and just please treat us with grace if you know someone with OCD in your life.